Understanding cervical cancer, a silent threat. Cervical cancer is a significant health issue that affects thousands of women worldwide each year. Despite advancements in medical science, it remains a leading cause of cancer-related deaths among women, particularly in developing countries where access to regular screening and vaccination is limited. Cervical cancer is a type of cancer that occurs in the cells of the cervix. These cells can undergo abnormal changes, leading to the development of cancerous growths. Early detection through regular pap smears and HPV testing is crucial in preventing the progression of these abnormal cells into cancer. The cervix is the lower part of the uterus that connects to the vagina. It plays a vital role in the female reproductive system, acting as a gateway between the uterus and the vagina. Understanding its function and health is essential for overall reproductive well-being. This type of cancer is often slow-growing, developing over many years. This slow progression provides a window of opportunity for early intervention and treatment, which can significantly improve outcomes and survival rates. It usually begins with precancerous changes in the cells of the cervix, known as dysplasia. Dysplasia can be detected through routine screening tests, allowing for early treatment before the cells become cancerous. A common cause of cervical cancer is the human papillomavirus, or HPV, a sexually transmitted infection. There are many types of HPV, but only some high-risk strains are linked to cervical cancer. Vaccination against HPV is a powerful tool in reducing the incidence of cervical cancer. HPV is very common, and most people will have it at some point in their lives. However, not all HPV infections lead to cancer. The body's immune system often clears the virus naturally. But persistent infections with high-risk HPV types can cause cellular changes that may develop into cancer over time. While most HPV infections clear up on their own, some high-risk types of HPV can lead to cervical cancer if left untreated. Regular screening, vaccination, and awareness are key to preventing cervical cancer and ensuring early detection and treatment. By staying informed and proactive, we can combat this silent threat and protect women's health worldwide. Silent symptoms. Early detection is key. Cervical cancer is often called a silent disease because in its early stages it may not cause any noticeable symptoms. This is why regular cervical cancer screenings are so crucial. Cervical cancer is often called a silent disease because in its early stages it may not cause any noticeable symptoms. This is why regular cervical cancer screenings are so crucial. These screenings, such as the pap smear and HPV test, can detect abnormal cells in the cervix before they turn into cancer. This is why regular cervical cancer screenings are so crucial. Early detection through these tests can save lives by identifying changes in the cervix at a stage when they are most treatable. Women are encouraged to start screening at the age of 21 and continue at regular intervals as recommended by their healthcare provider. As the cancer progresses, women may experience symptoms such as abnormal vaginal bleeding, unusual discharge, pelvic pain, or pain during intercourse. These symptoms can be alarming and should not be ignored. It's important to remember that these symptoms can also be caused by other conditions, but consulting a healthcare professional is essential to rule out cervical cancer. It's important to remember that these symptoms can also be caused by other conditions. However, it's essential to consult a healthcare professional if you experience any of these symptoms. Early consultation can lead to early diagnosis, which significantly improves the chances of successful treatment. However, it's essential to consult a healthcare professional if you experience any of these symptoms. Early detection is key to successful treatment. Regular screenings can detect precancerous changes in the cervix, allowing for early intervention and potentially preventing the development of cancer. Early detection is key to successful treatment. With early intervention, the chances of curing cervical cancer are significantly higher. Treatments may include surgery, radiation therapy, or chemotherapy, depending on the stage and severity of the cancer. Regular screenings can detect precancerous changes in the cervix, allowing for early intervention and potentially preventing the development of cancer. By staying informed and proactive about your health, you can take control and reduce the risk of cervical cancer. Remember, early detection is not just about catching cancer early, it's about preventing it from developing in the first place. Risk factors. Understanding your vulnerability. Several factors can increase a woman's risk of developing cervical cancer. These factors can be related to lifestyle choices, genetic predispositions, or even certain infections. Understanding these risk factors is important for taking proactive steps to protect your health. By being aware of what increases your risk, you can make informed decisions about your lifestyle and healthcare. One of the most significant risk factors is infection with high-risk types of HPV. Human papillomavirus, or HPV, is a common virus that can be transmitted through sexual contact. There are many types of HPV, but only some high-risk types are linked to cervical cancer. Other risk factors include smoking, which can weaken the immune system and make it harder for the body to fight off HPV infections. Smoking also introduces harmful chemicals into the body that can damage the cells of the cervix. Having a weakened immune system, whether due to conditions like HIV/AIDS, certain medications, or other health issues, can also increase the risk. A strong immune system is crucial for fighting off infections, including HPV. Additionally, having a family history of cervical cancer can elevate your risk. This suggests that genetic factors may play a role in the development of the disease. Early initiation of sexual activity, having multiple sexual partners, and engaging in unprotected sex can increase the likelihood of HPV infection, which in turn raises the risk of cervical cancer. A history of other sexually transmitted infections, such as chlamydia or gonorrhea, can also increase the risk. These infections can cause inflammation and changes in the cervical cells, making it easier for HPV to cause damage. It's important to note that having one or more risk factors does not mean that a woman will develop cervical cancer. It simply means that her risk is elevated compared to someone without these factors. By understanding and addressing these risk factors, women can take proactive steps to reduce their risk and protect their health. Regular screenings, vaccinations, and healthy lifestyle choices are key components of prevention. Prevention is power, vaccines, and screenings. The good news is that cervical cancer is highly preventable with vaccination and regular screenings. The HPV vaccine protects against the types of HPV that cause most cervical cancers. It is most effective when given to girls and boys before they become sexually active. A regular cervical cancer screenings, such as the PAP test and HPV test, can detect precancerous changes in the cervix early on, when treatment is most effective. The PAP test looks for abnormal cells in the cervix, while the HPV test detects the presence of high-risk HPV types. Section 5. Diagnosis and staging. Determining the path forward. If cervical cancer is suspected, a doctor will perform a pelvic exam and may recommend a biopsy to confirm the diagnosis. A biopsy involves taking a small sample of cervical tissue for examination under a microscope. If cancer is diagnosed, the next step is staging. Staging determines the extent of the cancer and helps guide treatment decisions. Staging may involve imaging tests such as a CT scan, MRI, or PET scan. Section 6. Treatment options, a multifaceted approach. Treatment for cervical cancer depends on several factors, including the stage of the cancer, the patient's overall health, and their preferences. Treatment options may include surgery, radiation therapy, chemotherapy, or a combination of these therapies. Surgery may involve removing the tumor, the cervix, or the entire uterus, depending on the extent of the cancer. Radiation therapy uses high-energy rays to kill cancer cells, while chemotherapy uses drugs to destroy cancer cells. Section 7. Palliative care, comfort and support. Palliative care is specialized medical care that focuses on providing relief from the symptoms and stress of a serious illness, such as cancer. The goal of palliative care is to improve the patient's quality of life by managing pain, nausea, fatigue, and other side effects of treatment. Palliative care is appropriate at any stage of illness and can be provided alongside curative treatments. It is an essential aspect of comprehensive cancer care, addressing the physical, emotional, and spiritual needs of the patient. Section 8. Coping and support systems, navigating the journey. A cancer diagnosis can be overwhelming, and it's essential for patients and their families to have access to support systems. Support groups, counseling, and online resources can provide emotional support, practical advice, and a sense of community. Talking to loved ones, joining support groups, and seeking professional counseling can help patients and families cope with the emotional and practical challenges of cancer. Remember, you are not alone in this journey. Section 9. A call to action prioritizing your cervical health. Cervical cancer is a preventable and treatable disease, especially when detected early. By understanding the risks, getting vaccinated against